kids that are egg allergic, they're likely from a family that one or both parents have one of the allergic diseases, not necessarily egg allergy, they just have allergic disease. And then they were exposed either in utero or through breastfeeding or topically, we don't really understand this part, to egg. And so put those two things together, then that's why 2.5% of kids develop egg allergy. So the treatment's administered, it's an egg white protein that's mixed with other food like applesauce. And then that applesauce egg white is swallowed by the patient, and we do that on a daily basis. And the whole concept is you start out at a very low dose to build up to a predetermined dose that we call a maintenance dose. And you start low so that you'll have less allergic side effects. And as you build up, your immune system changes so you no longer have those allergic side effects, and then get the desired effects of immunotherapy, which is to change your immune system. As you continue the treatment for the second year, about 3/4 of them could tolerate that same amount. And then when we stop the treatment in that group, then the overall group, about 30% of them could now eat egg in their diet. So they passed that third challenge, and they're consuming egg in their diet. Their immune system parameters that were before the study showed they're egg allergic no longer look like that. This is something that we need to look at in bigger studies, more kids, find out more about the allergic side effects. Are there any long-term allergic side effects that we don't really recognize yet? This is just a 2-year study. So the right thing to do right now is still avoidance. And if you have an axonal reaction, here's your antihistamine and your epinephrine, that's the right thing to do right now. The studies hold promise, but we're not there yet.
When we have a patient, typically a child who's got egg allergy, they usually grow out of it, often by the age of 3 or 4. And we need to, because egg can actually be fairly problematic in the type of reactions it can cause some nasty reactions, we want to make absolutely sure that the child is safe and not going to react. And what we do is we'll do skin prick tests to look for reactions in the skin. And we'll ask the parents, if the child's had any accidental contact and if they've reacted. We do a skin prick test and it's turned from positive to being negative. We think the child has probably grown out of it. But what we need to do is, in a controlled environment, test that child to make sure. We don't always get it right with the skin prick tests or the blood tests, and sometimes that child might actually still be sensitive. So we will either bring them into the ward or we'll do it in outpatients, and we'll do what we call an egg challenge. That involves asking mummy or daddy, whoever the best cook is, to make some scrambled egg and bring it in. And then what we do is we start off, we put a little bit on their skin, we wait 20 minutes to half an hour, we'll put some on their lips, on their tongue, get them to swallow a little bit, get them to swallow a bit more. If at any point we get a reaction, so for example if the side of the lip starts to swell, or if they get tingling in the mouth or their tongue starts to swell, we'll stop, we won't go any further. And we know that they're still sensitive, and we'll get them back after another period, say typically another year. But if all goes well and they can tolerate the egg, we say bye-bye, go and have some nice sort of quiche or whatever you fancy, egg custard, and be happy.
and finds that exposing children with egg allergies to very small doses of eggs over an extended period of time may reduce or even eliminate their allergic reactions. Here are some symptoms of food allergies. Skin symptoms including hives, angioedema, and itchy red rashes. Respiratory symptoms including cough, wheezing, and throat swelling. And GI symptoms including severe abdominal pain with vomiting or diarrhea. Researchers from the University of North Carolina studied 55 children who were allergic to eggs, randomizing 40 to oral immunotherapy and 15 to placebo for 10 months. The oral immunotherapy consisted of very small daily amounts of powdered egg whites, with the amount gradually increasing every 2 weeks. Children were followed for up to 3 years, periodically taking food challenges to assess their sensitivity. After 10 months, 55% of children taking oral immunotherapy were able to eat 5 grams of egg white, passing their food challenge, compared to none of those taking placebo. After 22 months, 75% of children in the oral immunotherapy group passed a food challenge of 10 grams of egg white. To test if this newfound tolerance would take, researchers then told the children who passed the second test to avoid eating eggs altogether for 4 to 6 weeks, afterwards allowing the children to resume eating eggs. Results showed that 28% of these children were able to eat eggs with no symptoms at all. We had a chance to speak with Dr. Wesley Burks, principal investigator of this study, who offered some further insight.
The main two messages are that the study shows that we can work with older egg allergic children, and with the process that was developed, that about a third of children treated after 2 years are able to put eggs back in their diet and eat them without any allergic symptoms. So that helps us that we know in the future that a treatment can be developed. But really the other message is that this is really the middle step in a 3-step process that gets something actually into the clinic, that the next series of studies need to be aimed at understanding the safety better, understanding how long the treatment needs to take place, and then more specifically about which patients would be better suited than others. So it's really not ready to be done yet. We literally started at 1/10,000th of an egg, and that's something that's really not practical and could easily cause too many allergic reactions if done inappropriately.
Today's research demonstrates that sensitizing children with food allergies to food they are allergic to has potential to reduce or even eliminate their allergic reactions. The authors emphasize, however, that this testing was done in a very controlled setting and with a very small amount of eggs and should not be attempted at home. For Insider Medicine in Depth, I'm Dr. Susan Sharma.
What food are you doing now?
Cashew.
And what food have you already finished?
Peanut.
Peanut. Do you like peanuts?
In it.
Well, for the past 5 years, we've been treating children with food allergy by giving them very, very, very teeny doses of the food that causes their reactions and gradually increasing that dose so they reach a point where they can eat the food regularly without having any reactions or problems.
This round he's being treated for cashew. Cashew on him was actually a little higher, a little more potent than peanut, so they did peanut first. He graduated with that, doing the peanut flours and peanuts. Got up to 20 some odd peanuts a day, and so he can eat any peanut. Now we're doing it again with cashew. He takes cashew powder twice a day, once in the morning, another dose 12 hours later. And then once a week we come in and he gets redosed at the next dose and watch him for an hour and see how he does. And then the next week we come back and do it again until he gets up to eating cashews, and then he'll be done.
About 85% of the children who start in the food allergy treatment program reach their target dose and are able to eat the food that caused them their problems. This has been the most gratifying thing that I have ever done in medicine. The parents tell us that we've really changed their lives, and that's very rewarding.
So.